much this morning. Fainting spells can happen anytime, sometimes in very public places. Yeah, like this one right here when BMW CEO, he collapsed during a new car presentation last year. It's pretty scary to see and probably even scarier to experience. Now, here to explain is Dr. Kevin Campbell. Dr. Campbell, great to see you.
Good to see you.
Afternoon to you. So tell us, what is a fainting spell and what are some of the common causes?
So a fainting spell occurs when you transiently lose consciousness. And the most common reason for that to happen is a sudden drop in blood pressure. Some of the things that cause passing out spells, or syncope as we call in medicine, can be very serious and life-threatening. Others don't really warrant any investigation at all.
Okay, so some are just a fluke, if you will. So we saw this on last Thursday, I think, during the first round of the NCAA basketball tournament. Everyone saw this one. Coach Tony Bennett of UVA, he collapsed on the sidelines at the PNC Arena. And we want to know what happened to this coach, Coach Bennett.
You know, based on the information we have, he has a disorder called vasovagal syncope, and that's when your blood pressure and your heart rate can drop suddenly.
Wow.
And sometimes if you get dehydrated and they think he may have had an illness antecedent to this event, when you get dehydrated, it can really make this worse. And I think that's probably what happened with Mr. Bennett. And the other good news is he's seen doctors in good places, and they've taken care of him, and he manages the disorder pretty well.
Yeah, they've got easy access to the doctors who basically follow along with the team. So for your everyday person, if this happens to them, when should they decide when to seek professional help?
First of all, it's very, very common. 6% of all ER visits are due to, passing out episodes. If you have something where you have injury, where you hit your head and need stitches, recurrent spells, if you have chest pain, if you have a history of heart disease or a family history of sudden death, you need to seek medical evaluation. The big thing is we have to figure out, is this caused by a heart problem, a neurologic problem, or something totally different? Because there's ways to treat this, and they can be life-threatening, some of the disorders, but most of these are really no big deal.
Okay, so if it happens to you and you are concerned, go ahead and check in with the doctor.
Absolutely.
Dr. Kevin Campbell, as always, very helpful. We appreciate your time, and you can reach out to Dr. Campbell with your medical questions and read more of his medical advice right now on WNCN.com. Love the pick, Doc.
Hey, thank you so much, Stephen.
Lots of very good information.